Hello, I'm Holly Cumberland. I'm a clinical nurse specialist at Woodlawn Wound Care, and I work on wounds, usually chronic wounds and acute wounds. I also take care of nail care and foot care. Clinical nurse specialist, let me kind of explain that. In Indiana, there's a group of nurses that are advanced practice nurses. A lot of people are familiar with the nurse practitioner, but not too many people are familiar with the clinical nurse specialist, which is what I am. We also have nurse midwife, nurse anesthetist, and those are the 4 advanced practice nurses here in Indiana. And so I'm a clinical nurse specialist. Usually we're focused more in the specialty areas, which mine is wound care. We started the wound care office or clinic about a year ago, back in March in 2014. We've been rolling ever since. We've actually picked up a lot of different patients from anywhere from acute injuries such as burns to chronic wounds that have never or failed to heal. And then also we take care of the nail care. As you know, not too many people, or ever since Dr. Rogers passed away, we didn't have a podiatrist here in town, so I went and got a wound care certification and also a foot nail care certification so I can trim toenails for diabetics or those who are having a difficult time trimming their toenails safely. Those that are on anticoagulant therapy, which is a blood thinner type thing. Anybody that has very thick toenails, which unfortunately as we get older our toenails kind of thicken up or we get a fungus. I take care of, like I said, the acute wounds, which are the burns or like a surgical site infection. Unfortunately, sometimes those happen to those who have, maybe diabetes or other risk factors that increases the risk of developing an infection after a surgical procedure. Also, I take care of the chronic wounds, which there's numerous ones of those, but the large ones are the venous stasis ulcers, the arterial ulcers, and then the diabetic ulcers or the neuropathic ulcers. Each of those have a different etiology or cause of those types of wounds. The venous stasis ulcers are usually the ones that drain a lot on the lower legs. You get a lot of swelling or edema in your lower legs, and then you drain a lot of that fluid outside of your system. And if you kind of think about a balloon that's filling up with water, because our veins actually leak fluid out of them for different reasons, then you get that pressure from the wound, or you get pressure from the edema that's that's leaking out into the system, and it kind of causes a new wound from pretty much the inside out. And so until we have compression on that sore or that wound area, you're going to fail to heal because you're always going to have that pressure that's coming out of that fluid, pushing on that skin level. The arterial issues is where we're not actually getting the blood flow down to our feet. And so if you don't have the nutrients, the oxygen, the blood flow down to a tissue in the lower part of your leg, you could develop a sore because that tissue is actually dying because it doesn't have the nutrients and the oxygen and that kind of thing. And so then you get a sore that way also. Many times what will end up happening is you'll kick your foot on a coffee table or a chair or in the dishwasher or something along that line, and then you'll fail to heal because you either have poor blood flow going down there or that pressure from the edema or the swelling that you get from the fluid leaking out of the veins. And so that's kind of where we kind of get those chronic wounds from, is they fail to heal because of those issues. Neuropathic ulcers or diabetic ulcers, this one's kind of interesting. A lot of people who have diabetes know that you get the numbness or the tingling in your feet that develop over time. There's actually different causes of that. You have the nervous system, okay? The autonomic, sensory, and the motor system, and those all cause different problems, and they get broken down over time through the diabetes, especially those who have really high blood pressure, high blood sugars, or just having diabetes alone can actually cause those problems. And so the autonomic one is where you actually get the decreased hair growth, or the oily part of your skin kind of decreases. Then you get the dry skin and the flaky skin and that kind of thing. The sensory, that's where you get the numbness and the tingling because the senses of your nerves are shot. And so you end up getting numbness, and then you don't feel anything that happens to your feet. And if you're not wearing shoes or protecting your feet from injury, then you end up getting those acute injuries that fail to heal. And then the motor part, I don't know if people have actually thought about this or have known anybody that has had this happen to them. And it's called a Charcot foot. Because the motor system fails, your feet actually change in structure. And so if you I'm going to kind of throw my hand up here, and I want you to do this at home too. If you take your hand and you have your little arch in your foot, okay? And as that motor system kind of fails and breaks down, your foot will actually change in directions and maybe even cause like a little rocker bottom type appearance, or you're going to have bony areas in your foot that aren't supposed to be where they are. And so as that develops and you're walking and not wearing proper shoes, then that friction and that shear will actually cause a callus. Well, if we kind of go back to the arterial flow issues and where we're not getting the blood and the nutrients and the oxygen down to our feet, if we have a callus, that callus actually will cause a decrease in blood flow too there. Which, how does that happen? It's because the callus will build up, and it'll get thicker and thicker and thicker. And as that gets thicker and thicker and thicker, I want you to take your finger at home, push on your hand or your arm or wherever, and hold it there for a few seconds. As that pressure builds up and builds up and builds up, we're cutting off circulation there. If we're cutting off circulation there, tissue's going to die and you're going to end up getting a hole. So it's very important to take care of those calluses properly too, is getting those pared down so that you don't develop those ulcers, the neuropathic ulcers, which are the diabetic ulcers, or at least it will at least reduce your risk of developing those ulcers. Important, very, very, very important is to wear proper shoes so that you decrease that risk of developing the calluses. Treatments for wounds, let's just start with the acute wounds first. Treatment for wounds really truly depends on the drainage that's coming out of the wound. If you've seen TV, there's a couple different commercials, and one just recently came out, and I wanted to bring this up to you. Is Band-Aid just started a new commercial for covering it. And they pretty much say, cover your wound and you'll end up healing 5 days faster. And then a lot of people are familiar with, say, Neosporin. Neosporin has actually put a commercial out there, will heal wounds 4 days faster. Ultimately, what that all comes down to is a moist wound environment. So back in the day, we used to leave our wounds open to air. Let it dry out. Needs air, it needs air, it needs air. Honestly, we're getting air to our wound from our blood system, because as we're breathing, we're oxygenating our blood circulates our body and it goes down to the area, and we're delivering oxygen to that wound that way. We all heal from the inside out. We're not going to heal from the outside in. Nobody does that. And so what you want to do is you want to make sure that you cover the wound, you want to absorb the drainage, and there's a big balancing act that kind of comes with absorbing the drainage. And that is, you don't want it to be too wet and you don't want it to be too dry. So too dry, obviously we're going to have cracked skin, we're going to have peeling skin, we're going to have the scab that develops that's going to start peeling away, and as that peels away, we have a raw sore, and then it's sore because it hurts, because it's open. Too wet. We've all kind of stood in the shower too long or sat in the hot tub too long. Not that I have a hot tub, but sat in the hot tub too long, stood in the shower too long, did way too many dishes from a holiday dinner, something along that line. And our fingers will turn pruny and white. That's actually weakened skin also. And so if you have a sore and you're soaking your foot in Epsom salt, or you're soaking your foot somewhere and that, it feels pretty good, so people leave it in there for, an hour or 30 minutes, whatever it takes. Well, the longer you leave that in there, the more macerated your skin gets, which is that white puffy stuff. And then as that skin weakens, the wound will actually get larger. So there's a balancing act of getting it just right. And so usually absorbing the drainage and making sure that the skin doesn't turn white around the edges of the wound, you're going to be okay, and you're going to heal a lot faster. Now, what happens when you do that? Ultimately, you need to change your bandage longer or sooner. Don't leave it open to air, but you do just need to absorb the drainage, change the bandage a little bit sooner, that kind of thing. Now, say the wound is too dry. That's where you want to get those ointments, such as the Neosporin or the bacitracin. I'm more of a proponent of bacitracin because it handles that whole MRSA thing a little more. But either way, you know, something on there to help moisten it up. Now, chronic wounds. Chronic wounds, those are the different ones that we have to heal. So we have the venous ones. Remember how I was talking about the edema and the swelling and that kind of thing? We need to have compression. What's important to know, though, is we need to know what your blood flow is going down to your foot before we put pressure on that ankle or that leg. If we put pressure on that ankle or leg and we don't know what your blood flow is going down to your foot, we could be causing a big problem and cutting off that circulation to your foot. And then we have a bigger problem, we don't have a foot anymore. So we want to be careful with applying compression. This isn't something that you should do at home. You should come in, you know, to a wound clinic or, you know, a professional that knows how to apply compression properly. Arterial issues, those are the ones that we're not having the blood flow get down to our feet. So depending on the situation, we could, there's like a big fine line here too, is that we have to be careful to not introduce bacteria. Now when we have an open wound that's not covered, that's not protected, then we have an opportunity to introduce bacteria into there, or viruses, or, you know, fungal infection or something along that line, and then cause a bigger problem. So there's a balancing act with that too. Sometimes it's important to leave those open to air, but not very often. So that's something that really needs to be evaluated by a professional on how to treat those arterial issues. Now when it comes to diabetic ulcers, those are the ones that have the bottom of the foot thing where the bone's poking through, and like if you do that with your hand and you push it down, that's what's happening to your foot. You can feel your bony prominences here that are causing pressure and causing those calluses to that area, cutting off circulation. Those are the ones that we actually have to offload. Offloading. What in the world is offloading? Offloading is literally taking pressure off of that foot so that it will actually heal, because as we're putting pressure on that foot by walking, cutting off more circulation, that sore will never heal. So how do we do that? The standard of care, or which is the normal practice that we should be doing, is the total contact casting. And that's where we put a cast on your foot. That way it offloads that area so you can actually heal. Now, it's not always safe to put a cast on somebody, so we could use a shoe that has, you know, we cut out the insert type thing and offload that way. We could use the casting. Sometimes I've actually healed somebody with crutches before, wheelchairs, those kinds of things. Something to get that pressure off that foot. Believe it or not, thinking about that pressure, you know, a lot of people I hear will go home, they're using their wheelchair or their crutches or something along that line, and what'll happen is they'll be like, oh, I have to go to the bathroom. It won't hurt too bad to get up and go to the bathroom. It'll only take me, you know, just a couple steps, okay? So people think, oh, I'm just going to take a few steps to the bathroom. It won't be that big of a deal. It's not going to make that big of a difference. They fail to heal too, because that little bit of pressure will actually slow down the healing process, if not make it worse. So it's important to really be very vigilant on offloading if you choose to use these other, you know, these other practices, such as the shoe or the crutches or the wheelchair or something along that line. I've had a lot of luck with the contact cast, and like I said, I've healed somebody with crutches before, those kind of things. Now, let's talk about more of the neuropathic ulcers, because these are some of the bigger problems that we have. As we have a sore that develops in our feet, we all know that our feet aren't the cleanest part of our body, and so they're close to the ground, they're, you know, sweaty in our shoes, they're whatever the case may be. So as we are thinking about our bony prominences that are poking out through our bottom of our feet, that kind of thing, we are close to the dirty areas, or walking in barefooted, or wearing sweaty shoes, or whatever the case may be. And then we get infections in that area. Well, unfortunately, what happens is that we're really close to that bone. Bacteria gets into the bone. Bone has blood flow going out, not very much coming in. And so we have a very difficult time getting that antibiotic into the bone, and so it's a very hard infection to fight. Is it possible? Yes, it's possible. Isn't it? You know, there's a lot of problems with that, though, and we can cause amputations later on down the road from a bone infection or something along that line. That's when we start seeing toes coming off. That's when we start seeing lower legs coming off, those kind of things. And so it's very, very, very important to take care of your calluses and protect your feet. How you do that, some of the things that you can do at home is getting into a habit of looking at your feet every single day. That's between your toes, because that's where our sweatiness happens, and that's when we get the white skin in between our toes, and then we get sores because that's weakened skin. Remember, I told you that. And then we have the sores on the bottom of our feet, where from the calluses or the bony areas or something along that line, or stubbing our toes. I'm a bad person about stubbing my toe. I stub my toe on pretty much everything underneath the sun. So stubbing your toes, breaking your toenail, get an ingrown toenail, calluses, corns, cracked heels, those kinds of things. It's very important to look at those areas and identify the open sores, and making sure that you bring it up to your primary care provider as soon as possible, especially if you have diabetes, which increases your risk of infections. You have arterial issues, the blood flow going down. Some of the signs of having arterial issues is decreased hair growth, pale skin. You can also have what's called dependent rubor. So this is a good test for you to do at home. If you drop your feet down to the ground, you hang them down there for a while and they turn red. Don't do my feet. I don't have the cute shoes or anything. Okay, so some tests that you can do at home. You drop your feet down to the ground. You let them dangle there for a while. If your legs or your feet turn this rubor or red, and then you raise them up above your heart and they turn pale again, that is what's called considered dependent rubor. So those are some of the signs of arterial issues too. Dry skin, because we're not having the blood flow going down there, and so we get the dry skin also. Some of the other things that you can do at home is making sure that you get in a habit of looking at your feet on a daily basis. If you're not able to reach your feet or see the bottom of your feet, you can either set up a mirror on like a full-length mirror on the wall or something like that. Take a chair, sit in front of it, and throw your foot up in front of it and take a look at the bottom of your foot. Or you can have those handheld mirrors and then just kind of hold it down to the bottom of your foot so you can kind of see that too. Or have a loved one or a friend kind of say, hey, look at my feet. What do you think? So those are some of the things that are very important to do. Another thing you can do is make sure that you check your shoes every day. I had a patient that couldn't understand why they had developed a sore on their foot. And so as I'm talking to them, I'm telling him the same things that I'm telling you right now. Check the feet, check your feet on a daily basis. Check your shoes. As I'm telling them this, I put my hand inside the shoe. I'm running it around the shoe, and boy, it was a soft shoe. It had that memory foam stuff in there, Soft shoe. I ran it around 3 times before I found a paper clip. And that's what was causing the sore on their foot. So it's very important to check those shoes, and that's the numbness that came out with those who have diabetes. And so it's very, very important to check those shoes. And it was buried. It was buried very well. Like I said, I couldn't feel it until the 3rd time around. So make sure you're checking your shoes for those objects. And a proper toenail cutting, if you're still able to safely cut your toenails, cutting straight across, making sure that you do pay attention to those corners. Try not to go down and around them, but make sure that you don't have a point on the end of them either. I'd like to encourage you to talk to your primary care provider to see if visiting Woodlawn Wound Care would be appropriate for you for any of your sores. Typically anything not healing over 30 days is something that you would definitely want to talk to your primary care provider about to see if you would be appropriate to come out and see me at the wound care. Also, if you have toenail issues or questions about your toenails, calluses, or corns, just feel free to go ahead and give us a call and schedule an appointment. Our phone number is 223-9393. Again, it's 223-9393. And again, my name is Holly Cumberland, and I'm a clinical nurse specialist out there at Woodlawn Wound Care.